Before we start, I'd like to just a moment of silence. City Councilor Melvin Edwards' dad had passed away, so if we just have a moment of silence, our sympathy, thoughts, and prayers to Melvin and his family. Thank you very much. Again, I'm deeply appreciative of Dr. Mark Kerouac, the CEO and President of Bay State Health Systems, and Dr. Robert Ruse, the Chief Medical Officer of Mercy Hospital Trinity Healthcare, are both here as we have done before. We will do again. After I give my update, we will bring up Dr. Kerouac and Dr. Ruse, so they will give their hospital and medical perspective update, and then we'll take questions immediately for these two gentlemen so they can get back to their important duties at their well-respected medical establishments. Then we'll go back into my cabinet heads. I also want to, earlier this morning, we wished Archbishop Mitchell Rosansky a farewell, bittersweet. He's leaving St. Louis to become Archbishop there, and don't be surprised if shortly he doesn't get called to Rome and has that red cap on, being called a cardinal. So we're bittersweet. He did a great job here, and I'm going to miss him. On the updates, again, our trend continues to be good. As Governor Baker, when he called me last week, when his mapping was coming out, and he had indicated, Mayor, that for an urban center such as Springfield, knock on wood, we're doing very well. We're only a quarter of a point, 0.25, a quarter of a point away from being a green zone, which the only two high-risk areas here is, I believe, Holyoke and Granby. So that's quite a testament to my cabinet heads at rank and file and to our residents and business community. So we got to keep it going. We have to keep it going. Friday we had 3. Saturday a little bit of an uptick. We've had very few double digits, but we had 11. Sunday was 9. For total confirmed COVID-19 cases of 2,941. I'm happy to report another update from Commissioner Helen Carlton Harris. She'll go in more specifics when she comes up. Deaths have held steady. We're at 130, and again, one is too many, and our thoughts and prayers and sympathy and encouragement to the affected families. So those numbers hold. 56 white, which is 43.1%. Latino is 41, which is 31.5%. Black is 31, which is 23.8%, and Asian is 1.5%. The long-term care number holds at 57, and the residential deaths hold at 73. We continue with our senior meals and outreach. We're nearly about 15,000 meals have been delivered and served to seniors who have requested in need of meals. And we continue with our outreach with the arts and craft distribution that continues on. Commissioner Helen Carlton Harris will update you. She is setting up even more and working with the state, DPH, and Governor Baker. Numerous more testing sites are going to be set up. She'll get into that. She's also going to speak to you about Triple E, which is back in town again, the mosquitoes. She'll give you an update on that. I see Patrick Leonardo is here, the Director of Operations of AMR, Ambulance. We appreciate that, Patrick. Just to give you some quick, brief updates. Again, I'm elated that I was able to reach out and bring on retired Mass Supreme Court Justice Roderick Ireland to help assist myself and our Springfield Police Department in working with the Department of Justice, DOJ, as we continue. Commissioner Clapper continues to put across initiatives and reforms. I think this will be a win-win and a golden opportunity to continue to highlight what our SPD does very well and what we need to do better in for our residents and business community. So we look forward to that collaboration. We did receive a very generous donation from the Eastman Corporation through Tony Signoli. 5,000 cloth masks were dropped off just the other day. We appreciate that. We also on Fema Grants, and I want to thank Congressman Neal and my city team, about $550,000 to repair the culvert at the South Branch Parkway. This was hit during the 2011 tornado. This is, again, pre-disaster mitigation funds, and that's a testament to Pat Sullivan and the rest of the team, and Timmy Sheehan, Tina Quagliato, Sullivan, being proactive, and this is preventative money. As I mentioned, Governor Baker, we are 0.25%, a quarter of a point away from being a green zone, which is quite a testament for an urban center. I'd also like to make mention that two things on the police front before I go direct police update. Drag racing. We continue to have our units out there, and not only in the north end, but in the south end and other areas of the city. And 8 arrests were made pertaining to that. We're going to continue that crackdown on it. But I have to tell you something. COVID-19, other things, this sense of lawlessness has to stop. And if you're not going to stop it, I'm going to stop it with our police department. And I need our courts to help us out. And when I talk about this sense of lawlessness, about respect, the drag racing, and I'll go into it in a police report, this is very dangerous, not only for the people participating in it, but for the bystanders, and also for our police officers, one that was nearly run over the other night. And I'm also going to give to the illegal dirt bikes, which we continue to confiscate them, and to the bicycle riders. Cut the crap. I mean, this daredevil stuff is not only possibly going to get you hurt, it's going to get innocent people hurt who are driving their cars. So I'm getting sick and tired of this lawlessness, as are many people that I'm hearing from. So Springfield Police will continue on a crackdown with that. And we're also going to crack down on quality of life issues. People just cannot park wherever the hell they want to park. On their front lawns, on the beautiful terraces we have in the city of Springfield. So there's going to be a crackdown on that too, with code enforcement, ordinance squad, and the police department. So enough of this stuff parking illegally on your front lawns or front areas or on our terraces too. So I'm giving you a fair warning on that. Let's try to be respectful. In the meantime, even with this COVID-19 going on and all the challenges we face pertaining to social unrest, overall crime, many other areas it's up. Overall crime in the city of Springfield is down 3%. 3%. So giving you fair warning on that. We had a beautiful ceremony Saturday morning here at City Hall. The first time, the Springfield Pride, it was first time ever in the city's history the transgender flag was raised. And Ali Hack, the young man who was the president, was here. And it was really a nice event. And I met a young lady, Mimi. She is a student at Dorman School, I think 4th or 5th grade going into, and just was a very special young lady, and she did a nice job there. Election drop box has been put, Pat Sullivan and crew, we appreciate facilities management. The back of City Hall makes it very, very easy. This is a secured lock box for the mail-in ballots. You can drop them right in there securely, and that's important. And I need to remind you, as Commissioner Gladys Iola will continue to remind you too, that the census, please fill out your census. We need that census ASAP. And just to let you know, every night, there's a question on these mail-in ballots. Every night, the post office truck is here at City Hall, and elections loads up those ballots every night. A couple nights I've helped them load the ballots too, so they get to the post office to get out. So we want to make you aware of that. On the police, Update, right now, we're not down anybody in COVID. That's fantastic. Deputy Kent has indicated that to me. Unfortunately, we did have a homicide, Central Rifle Street, the one-stop plaza there, over the weekend. Police are working hard. They do have leads, and I feel very confident they'll be making an arrest very shortly, and hopefully our courts will hold the individual or individuals on that. Narcotics continues to work very hard. 2 more major raids, guns taken off the street, $32,000 brought in off narcotic raids. Again, I spoke about the anti-drag racing, 8 arrests. Car tried to run over one of our officers, which is, we have body cameras now. It's all been on record, and the officer had to utilize a weapon to stop that. No one was injured at that point in time. But the gall of these people to try to run over one of our officers, that's what our police department faces day in and day out. Fire Department, Commissioner Calvi, 1 down with COVID. We just received a $250,000 grant, COVID-19 related grant on reimbursement, which CAFO TJ Plant has. Deputy Director Vinny DeSantis is here from DPW. They're down 1 in COVID. They had a little landfill of compost, little fire, which was contained very quickly. I guess it was self-combustion there that occurred. They're getting caught up on yard work, and I want to commend DPW and for the storm cleanup, trying to help out our residents on that on the recycling days. Pat Sullivan, Directors of Facilities Management and Parks. Setup is occurring already for the early voting, which we have listed. Pat continues, we continue to stockpile COVID-19 supplies. We're seeking more clarification, Governor Baker's edict on golf aspects. And Bob Kirshner, who is the industrial hygienist that Director Sullivan, Commissioner Helen Carlton Harris, Superintendent Warwick, and I brought in, is starting his physical examination of our schools to make sure that they're safe and sound pertaining to COVID requirements. And we're going to start remote, but our goal is, once it's public health, medicine, and sciences, to get our kids back in school as soon as possible. Storm cleanup, Pat, your team is in forestry and with Sheriff Cochise crew and the state crew, the governor from Pat Carnevale, Department of Recreation Conservation has done a very good job staying on top of that. Superintendent Warwick indicates that we've nearly served 2.3 million meals, breakfast, lunch, dinner, snacks. We are doing evening, and just over the weekend, over 84,000 meals went out. The superintendent, working with my city side, we're going to be able to purchase now for pre-K the iPads, which Superintendent Warwick will speak about. For the kids, that'll be fantastic. Tim Sheehan, my Chief Development Officer, Economic Development. We had the public meeting to amend the HUD money, and we're looking to pump in another $1.2 to $1.3 million to our small businesses as soon as possible on Prime to Pump. So, and we're going to try to work with Common Capital to leverage even more money to come in. So when you total that up, and Timmy will speak about it, besides the $2 million for our residents to pay mortgages, rents, and utilities, we're probably nearing with this money over $3 million. So we probably put out $5 to $6 million grants, straight grants, to help our small businesses and residents survive and stabilize. On the financial front, my CAFO, TJ Plan, indicates about $8 million in COVID-19 relief we've spent. For FY21, this current budget year, we are down $547,000, and we've lost about $5.4 million in lost revenue. Again, I will spend every dime that I can for our residents and business community, as I've done before. We've done before with natural and man-made disasters. We will track everything and go after every dime of reimbursement. The legal updates from Solicitor Pakula and HR and Labor Director Bill Mahoney were status quo with that. So now let me bring up Dr. Mark Kerouac, who is the President and CEO, again, of Bay State Health Systems. And, he has some good news, too, that numbers continue to go down, but we have to stay ever vigilant. So without further ado, the President and CEO of Bay State Health Systems, Dr. Mark Kerouac. Thank you.
Well, good morning, everybody, and thank you, Mr. Mayor, for holding these events and for getting the word out. Appreciate your leadership on this and also the collaboration with the members of your team. As the Mayor mentioned, we do have some good news at Bay State. We're continuing to care for patients with COVID-19, and as of this morning, we had 14 patients at Bay State Medical Center with only one in critical care, an additional patient over at Bay State Noble, so 15 at all in the health system, and that's down from 30 just a couple of weeks ago. We continue actively testing, averaging about 800 tests a day. We have a capacity for 1,000, but we continue to scrounge for testing supplies based on competition from other areas of the country, as well as from other industries, because more testing is encumbered when we start reopening other parts of the economy. In spite of the strain, we have continued to support congregate living facilities, nursing homes, public housing, other healthcare providers. Recently had an event down at the Martin Luther King Center on Mason Square, which is a neighborhood that's been pretty hard hit by the virus. Statewide, positive test rates have declined to 1.4%. In the last 7 days at Bay State, they've been at 1.1%. So these are all very good trends. As the Mayor mentioned, the state is now generating a weekly public health report, quite extensive, that includes a map. I made a high-tech graphic, Mr. Mayor. I know you studied that map, but I thought I'd show it to people. It essentially shows town by town the incidence rate, that means new cases of COVID-19 over the last 14 days per 100,000 population. And there are 3 different colors. White means nothing much is going on, so good place to be is out in the Berkshires or the hill towns, as you can see. Green means not much is going on. Yellow is sort of middle of the road, and red would be some of the areas where there's more activity. So you can see that Springfield is in the yellow, almost in the green. Other towns that are in the yellow include Longmeadow, Chicopee, South Hadley, East Hampton, and Northampton. Both Holyoke and Granby are in the red. I suspect that Granby, it's because it's just a small population. They only had 7 tests, pardon me, 7 positive cases over the last 2 weeks, and so 3 fewer cases, they would have been in the white. So very small population there. These data are useful in deciding on local plans, such as whether to reopen schools or businesses, and they help us to identify hotspots. And as I say, that report comes out every Wednesday, and there's a lot of information in it. Overall, the state is, and by the way, the map also shows that the virus continues to spread in our communities. It is out there. It's only as a result of active efforts on the part of everybody that we've been able to keep it at low levels. And as the Mayor says, we're awfully close to even being in the green zone. So my hope is that we can continue to knock things lower, and which would enable us to be successful at reopening schools and businesses sometime down the road. Overall, the state is doing well in terms of the measures they follow, such as test positivity rates, hospitalizations, capacity for testing, and the effectiveness of contact tracing. Nationally, the United States is still seeing some troubles. We passed 5 million cases just last week with 168,000 deaths. Globally, we passed 21 million cases with 760,000 deaths. Even with that death estimate in the United States at 168,000, that is likely an underestimate because everybody who ought to be tested is not getting tested. A recent study that came out again just last week looked at overall death rates week by week in the United States. And in the pre-COVID era, that was a pretty flat rate, not much change from week to week over the course of the year, except when flu season came, when you'd see a little bit of a hump. Now we've actually seen an increase in death rates in states that are having these COVID outbreaks. And it estimated based on that statistic, people feel that the mortality rates could be somewhere in the order of 200,000 rather than the 168 that we've been looking at. All of this speaks to the same message that I've been giving week after week here, the importance of maintaining adherence to the guidelines, such as hand washing, masking, physical distancing. Any of these little simmering areas in the communities in our neighborhoods could get out of control if we decide to give up on these. And so it's important for all of us to continue to do our part. I'll also put in my brief plug to remember to respond to the census. For all of us in the healthcare industry, about 2/3 of our revenue comes from state payers like Medicare and Medicaid, and it's important for us all to be counted so that public institutions, towns, and municipalities get their fair share of federal reimbursement. So please do fill it out, and do remember to vote, too. So, Mr. Mayor, I appreciate the opportunity.
Thank you, Dr. Kerouac. We'll now bring up Dr. Robert Rooms, who's the Chief Medical Officer for Mercy Hospital Trinity Healthcare, and then after that, questions may be asked of Dr. Kerouac and Dr. Roos. Dr. Roos?
Thank you, Mayor, and good morning, everyone. I want to thank you, Mayor, and your entire cabinet for the incredible work when looking at the incidence rates of COVID in Springfield, and also to the media for continuing to put out the important messages and creating an opportunity to communicate about the latest in regards to the science and the data as it pertains to the pandemic. We do know that the coronavirus is still very much present in our community, and there are some cities and towns that have been identified as having a higher incidence rate of the coronavirus infections, and for that it will allow us to target resources to best mitigate and decrease those rates going forward. I'm also extremely heartened and proud not only of the way that we've responded over the last several months to this pandemic, but also because of the work that we're continuing to do to keep the virus at bay. And so good news in many, many regards today. While the total number of infections across the country has approached and largely is underrepresented at the total of about 5.5 million, the United States also has a test positivity rate of about 8%. But here in Massachusetts, and particularly in Western Massachusetts, we've shown that a science and data-driven approach, along with everyone in the community adhering to the public health recommendations seriously, in fact, does work. And here in Massachusetts, as we know and was reported, we have our lowest test positivity rate as a Commonwealth since the beginning of the pandemic at 1.4%. That shows clearly that if we are cautious and data-driven in regards to reopening and vigilant in regards to maintaining ourselves, our behaviors, and our actions to continue with masking, hand hygiene, and physical distancing, we can not only support each other's health, but we can also safely support the livelihood of our community and reopen successfully. This week, accordingly, the report from Mercy and throughout Trinity Health is one that's full of gratitude for that good news. I personally continue to be impressed by our colleagues in the hospital, our physicians and providers, our nurses, and all of the related departments that contribute to the patient care and taking care of people and working every day to ensure that we provide safe care. I also want to recognize our pre-hospital providers, our EMS, our first responders, public health officials, and all of our partners who are not only making a huge difference in protecting our community from COVID, but also to showing the community that they can trust the services that they receive and the care that they need. Our numbers at Mercy have remained low over the course of the past week, and our trend is also moving in the right direction. As of this morning at Mercy Medical Center, we have 4 confirmed positive COVID cases, with 1 in the intensive care unit. And after having performed now more than 32,000 tests in total, our test positivity rate has also trended down and is at 1.4% over the last week, after having increased to closer to 2% in about several weeks ago. And so I remain very grateful to everyone for their work in remaining vigilant. I do want to recognize today, at this kind of critical juncture in the pandemic, that it has not been easy. We know that we have changed many things about our lives over the course of the past 6 months. It's been exhausting on multiple levels: a mental level, a physical level, a social level. And in times of crisis, we're often called to do things and do more, to work longer hours in grueling situations, to do things differently, like educate in a hybrid or remote learning environment, and to continue to confront unique and challenging circumstances on a daily basis. And we know that the fatigue is real. The fatigue from wearing masks constantly, or from just flat out being ready to return to the lives that we had in the past. But this fall and winter, we could be dealing not only with an increase in coronavirus cases, but also influenza. And we want to recognize that these 2 pandemics could collide in ways that exacerbate the impact of both of them. There was a recent research report that was published in the Journal of the American Medical Association last week that provided a bit of perspective on the seriousness of the COVID pandemic and its relationship to one of the prior widespread infectious disease pandemics that we've all become more familiar with over the past 6 months, the Spanish flu pandemic of 1918. And this study looked at the excess mortality and the deaths that the Spanish flu contributed to in 1918 in the city of New York City, and compared it to the overall population at that time, and then looked at the deaths related to and the excess mortality from COVID in early 2020 relative to the population. And what it showed is actually what we're dealing with now is so unprecedented that the excess mortality contributed by the Spanish flu was slightly higher per death per 100,000 people living in the city, but it was comparable overall. But what was striking was that the increase in excess mortality caused by COVID was about double that from the Spanish flu relative to mortality rates pre-pandemic. So we're dealing with something now that literally has not been dealt with in 100 years, in a pandemic that's been etched into our history books, and one that has informed public health and infectious disease for generations to follow, is now something that we are dealing with and we know is going to impact life for generations to come. And that's why when we think about the focus now at this key moment, we have shifted to what's going to happen in the fall and the winter. And we're focusing not only on reinforcing the gains that we've made and celebrating those successes, but also maintaining our resolve for what could be the long winter, so to speak. At Mercy, we're doing that in the following ways. First, we are bolstering the safe care. We continue to provide for both COVID and non-COVID patients, and we're maintaining the policies and procedures that we put into place throughout this pandemic. Secondly, we've recently evaluated and modified our surge plans to ensure that we could be prepared for increases in hospitalized patients, be it COVID or influenza or both, and increasing our capacity to potentially up to double in both our emergency departments and intensive care units, while we would continue to provide, if appropriate, the essential care that our community needs, like surgeries and imaging studies. Third, we're working daily now to ensure that during this slower period, we build up the resources that we might need in a period when the pandemic increases. Supplies like PPE and testing kits and reagents. We've been fortunate to have enough PPE throughout the pandemic, including masks, N95, gowns, and gloves. But we know that now the demand for testing kits and reagents has become much more limited. As you know, adequate testing with both accuracy and reasonable turnaround times is critical to stopping or slowing the spread of COVID. It's critical to identifying individuals who need to be quarantined, as well as the successful ability to contact trace. At Mercy, we still have a small capacity to be able to do tests, a molecular test where we can have a turnaround of an hour or two that's really focused on patients that are in the hospital that need care urgently. We continue to have testing resources to be able to do several hundred other tests, up to about 400 to 500 per day, with a turnaround of 8 to 24 hours. But I concur that our ability to continue to perform more tests than that, without sending some out to reference labs and having those increasing turnaround times, is becoming ever more challenging on a daily basis. And as a country, we are still well behind where we should be in terms of supplies, and it makes it more difficult for them to come by. Lastly, right now, I just want to mention that we are continuing to bolster the strengths of our colleagues at the hospital and building resiliency for what we know is going to be a long foreseeable future with COVID. We're all experiencing some level of fatigue, whether it's PPE fatigue or what some people have called pandemic exhaustion. We know that some people may be feeling more stressed or anxious or even depressed. And at Mercy, we think now is the right time to really be doubling down and reinforcing our efforts to build not only direct assistance, but also building resilience for the future. So we've created space in the hospital for colleagues to go if they need a moment to themselves and create some mindfulness. We have teams that are now going directly to the units on multiple shifts to provide support and do workshops to build resiliency. At this point, after this initial surge, we've done a tremendous job in taming the spread of the virus, but now is the time for us to be vigilant, lay the foundation, and create the reserves to be ready to fight the fires again if they were to resurge. So I do want to thank everyone for their efforts, from teachers to parents to the media, restaurant business owners, and workers. It's often been said that healthcare workers are on the front lines. And in many ways we are, in terms of treatment and dealing with the complications and consequences of this illness. But in reality, if you think about it, with a public health crisis like this, where the prevention is what matters, you are truly the front lines, because you have the power and the ability to prevent the infections, to reduce the transmission. We, as healthcare providers and hospitals, are not really the front lines at that point, but the last lines of defense. The more that we can do up front, the better. We'll continue to be here for you and prioritize your safety and well-being. I will leave you with the same thoughts we have reiterated week after week. Please, for yourself, for your loved ones and families, wear a mask. And we've learned there are some that are more effective than others. Sanitize your hands. Be mindful and limit your travel. Keep your physical distance from others. And be cautious about where you go and who you interact with. These actions do work. We are seeing their results. And as we move towards the fall, I will add one more. Be sure to vaccinate yourself against the flu when it's available. Thank you.
Thank you, Dr. Roos. Dr. Kerouac and Dr. Roos will now be available for questions on Taylor 1922. Mr. Mayor's news call, will be react. So any questions now for the doctors? Taylor?
There's that new saliva test out by Yale. Could that be used here in Western Massachusetts, and could it increase testing capacity around here?
I'll just comment briefly that from what I know about that test, we do not have the equipment that is necessary to be able to run that test within our laboratories at Mercy Medical Center. So we'll continue to evaluate if that's something that we can bring in, but in the moment, that's not something we can utilize here in this community.
Yeah, and I think the only thing I'd add to that is we always need to take a look at what's the true positive rate, the false positive rate, the true negative rate, the false negative rate. Something that performs less well on those would be good for mass screening, but not good for the sort of things we do in the hospital.
Any other questions?
Doctors, the last couple of weeks we've seen a broad number of cases and has gone up noticeably. And at the same time, have things improved from the fears that we had just a couple of weeks ago, or is it just that we're testing more so the positivity rate was smaller?
I think things are changing. We are starting to see cases in younger age groups, and we also are seeing the effects of effective treatments like immune therapies, remdesivir, dexamethasone. So for example, if you look at a state like Arizona, they have 190,000 cases compared to about 115,000 in Massachusetts, but we've got over 8,000 deaths, they've only got 4,000. And it's testament to the fact that it hit them later when the treatments were better known, and it hit younger populations in that state. So the way the virus is affecting the population reflects the fact that I think older people are doing a better job of protecting themselves than younger people. Many of the outbreaks that have occurred in bars, et cetera, big parties, have been in younger individuals.
I completely agree, and the only thing that I would add is about 3 or 4 weeks ago, we were more concerned about the current state, and that was because the test positivity rate was slightly increasing. There is going to be a little bit of a lag between the test positivity rate where we're getting the results of those tests in that moment with the connection to hospitalizations in some cases. So I would expect as the test positivity rate now is back declining, we will start to see the hospitalizations slowly recede as well, in addition to the elements that Dr. Kerouac reviewed. There is going to be a lag of when we'd see the hospitalizations and then when we would see those patients successfully discharged. That would account for some of the weeks delay.
And we have seen that there was an increase at both hospitals. I'm sure some of that was partly based on the outbreak of more hospitalized for COVID, kind of COVID, and that's now gone down a little bit. Is this partly due to the fact that it's just that there's less need for people to come in, or the number amount of time people are in the hospital is so much lower now than it might have been even a couple months ago?
I think it's probably some of both. I think when with individuals that are testing positive, if it is in a younger population with less comorbidities, they would be less at risk of needing a hospitalization. And I think I want to echo again what Dr. Kerouac said, more effective treatments, earlier intervention with both pharmacologic and non-pharmacologic interventions. If we compared patients hospitalized with COVID now in August versus those hospitalized in March, I have not done the analysis, but we would likely see a lower length of stay of those individual patients as well.
Dr. Kerouac, anything else you want to add?
No, I think the only other thing I would say is that we're seeing the improved treatment reflected in reduced use of critical care as well. Only one of our 15 patients is in a critical care unit, whereas before it would have been about 1 in 4 at the peak of the epidemic.
And one more question. In terms of, it's obviously, mass social distancing, things that they're going to use as a bare minimum through the end of the year. Would these also help reduce the incidence of influenza as well?
Yeah, there's a big debate going on in the infectious disease community. Is it going to be a bad flu year or a good flu year? You can put your bets on now, even though I don't know if MGM is going to allow that game to be open or not. But I'd put my money on it's going to be a mild flu year, because the same things that protect you against COVID protect you against flu. So to the extent, so that if we were doing this during every flu season, we'd have much less flu. It just has never been a social norm in this country, although it has been in many Asian countries.
I agree, and I think that we would likely see the same impact in the reduction and transmission of flu based on the same principles, and hopeful that we'll be optimistic and have that happen.
Does not mean you shouldn't get your flu shot, though.
Exactly.
That was a good question now. Paul?
Some colleges in the area are going to be bringing students back on campus in a matter of a few weeks. Have the hospitals had any discussions with the colleges about their plans for testing, contact tracing, what they're going to do if they are going to have cases? I don't think there's any doubt about that, but how they're going to respond to this?
Yeah, I've had a number of informal conversations with college leaders, boarding school leaders, school officials, et cetera. And I think it's very hard to give one-size-fits-all recommendations. The Department of Higher Ed has put out a set of recommendations, and each college has to decide based on how controlled or confined the student population is, how many, what the consequences of remote learning would be. So each school has to, just like each school district, has to craft their own specific plan within the guidelines provided that take into account the physical facility, whether students are off campus or on campus, how many need to do labs versus, simply read books. So I think it's really hard to do a one-size-fits-all, but of all the folks I've spoken to, they have really taken a very thoughtful view of things and have developed plans that are appropriate, I think, for their areas. To the extent that we can keep overall case levels low, we can make it easier on the superintendents and the college presidents to get away with, if you will, a hybrid or full reopening.
Thank you, Dr. Lewis. I don't have anything much.
Commissioner Carlton-Harris, Helen Carlton-Harris has also been in discussion with the college leaders, Springfield-based college leaders. Any other questions of Dr. Carroll, Dr. Lewis? Gentlemen, thank you so much. It's a good
Pleasure.
meeting
Thank you.
you.
Thanks, everybody.
Good luck. Appreciate it. And thanks again to the media for continuing to get this information out. We deeply appreciate it. We'll now go into the city portion update, and we'll start with the public health and safety first. And my point person, she's done yeoman work, has been the Health and Human Services Commissioner of the City of Springfield, Helen Carlton-Harris.
Where's my Bill?
Billy.
Billy?
Billy.
Can you help me with this? I'm not sure I can do that.
Billy and I are like the Vanna White for
Okay, all
It's
right.
taken me days to figure it out, Billy. Thanks, Billy.
You got it? Yep. Good, thank you. Thank you. Mayor, again, thank you for your support. Very appreciated. Over the past week, there have been tremendous strides made in testing in the city of Springfield. To date, we'd had the ability to expand our testing capacity enormously. Testing has been done at several sites, the South End Middle School, Zanetti, Kennedy, Martin Luther King Community Center, New North Citizens Council. Although we have done testing at multiple sites, we have tested over the past week 432 additional Springfield residents in our community. And that's important to acknowledge because prior to testing, our positivity rate or number was 37. This past week, it was 53. However, it's important to acknowledge how many, that's 16 additional over a week, but we have tested during that week 432 individuals, and so that is really important. We will be standing up testing this week, August 19th, August 21st, August 26th, August 28th, September 2nd, September 4th, September 9th, and September 11th. It is important to say that because those dates are concrete. We do not yet have the sites. I've also been told just a few minutes ago from Patrick Leonardo that AMR has also been confirmed to be able to do testing for the city. And so we're very, very pleased about that. We, as the city of Springfield, you've heard from Dr. Kerouac, are yellow. And so that means our prevalence rate is 4 to 6 cases per 100,000. We have, as the mayor said, we were very close to being green. And so that's important, and that is really a testament to the residents of the city of Springfield and the prevention that you have done and following the guidance. We're very much appreciated. Many of the calls we get on our hotline continue to be around individuals who are not following the guidance. Every day, we must get at least 20 calls telling us about a case or an incident where an individual has seen someone in a particular venue who is not following the guidance. We once again ask you to follow the guidance and understand that there are residents out there who are being vigilant and who are paying attention to who is wearing face coverings and who is not. And they're doing that to protect your health and protect their health. We appreciate the cooperation that we've gotten. We would appreciate that we continue to have the cooperation of the public. We still have a mask mandate for the public. Remember why that's in place. Remember what that is. If you cannot socially distance from someone for 6 feet, it is important that you have a face covering on. When you are walking down the street with individuals that you don't know and who are not a part of your family, or you don't know where they have been, because remember, the virus is spread by droplets, and there is still community spread out there. So please continue to be vigilant. We are most appreciative of the numbers that we're seeing. However, we do want to get solidly in green, or the best case scenario, be in a white zone where the virus is not detectable. Contact tracing is still one of the cornerstones of our public health response. Please remember to respond and give the information to who you're talking to. And if you are COVID positive, please continue to isolate yourself. Isolate yourself. That's important. And make sure those around you who have been exposed are quarantined. Travel orders are still in place. They're in effect for the Commonwealth of Massachusetts. It is important to acknowledge that if someone is coming from out of state, again, they either quarantine for 14 days or they have a negative test. Rhode Island, as you know, has been added to the list. The rest of the United States is on that list. And so remember, that's really important. I would recommend, if you're planning to go out of town, please schedule your COVID test before you leave, so that when you come back, you can get the test immediately and immediately be ruled out and go back to work. Gatherings. Outdoor gatherings, as you know, has been reduced from 100 to 50 outdoors and remains at 25 indoors. The colleges, as the mayor said, we are working with all of the colleges. What we will wind up doing is developing memorandums of understanding with each of the Springfield colleges. What that means is the colleges will tell us how they are going to operate, and then we will talk about how we will partner in terms of, if a college student is positive in the city of Springfield, that report will come through the MAVEN system and will be contact traced by our department or by the college, should they choose to do that. So we are developing memorandums of understanding with every college who is based in the city of Springfield, so we know exactly how each one of us will behave should there be an outbreak or a cluster. That's important because contact tracing, the colleges will know how to do that. They know who's in that environment. They will know who that student has come in contact with. They will know all of the dorm if that individual has stayed in a dorm. So some colleges will do their own contact tracing. Others are asking us to assist, but we will work in partnership with our colleges. The colleges, the students will be using Springfield addresses, the address of their college. So again, those will be numbers that will be reported to the Board of Health. We are continuing to advise each other around the the students coming back on college campuses. So we're working with our colleges. We've gotten great cooperation from every one of the colleges in the city, and I am extremely glad and pleased that our staff has reached out in a concrete way. Springfield has been moved to the moderate risk category for Eastern Equine Encephalitis, EE. It is a rare but very serious illness that can cause death in people of all ages. It is transmitted by mosquitoes who carry the virus. The personal protective equipment for EE is using a EPA-registered insect repellent, wearing clothes that cover your skin, ensuring that your window screens do not have holes in them or that mosquitoes cannot get into your home. Keep your screens in good shape. Discard standing water that might be in tires, that might be in buckets, flower pots, planters' toys, or any place around your home where you see standing water. Please discard that. That's going to be very, very important. Again, I've told you that the State Department of Public Health has mosquito traps that are around the Commonwealth and the city of Springfield. They take the mosquitoes out of those traps, test them, and to learn the prevalence of EE or West Nile virus in our area. And so we are at moderate risk in the city of Springfield. I will ask that you keep that in mind, and please take those preventative actions. Flu season. You've heard a little bit about flu season from the two doctors, and I am very appreciative. But although it could potentially be a mild flu season, as the doctor said, I don't think anybody really knows what this flu season is going to be like, because we have not experienced COVID in conjunction with a flu season. However, the doctor's points around face covering, hand washing, those things that we're doing for COVID could potentially have an impact on flu season. I'm going to ask you to remember also to get your flu shot. While we continue to battle COVID-19, it is important that we do get a flu shot, which is recommended for individuals from 6 months to 4 years, individuals over 50, individuals with underlying chronic conditions. If you have any concerns about whether you're high risk and need to get a flu shot, please go to the CDC website, DPH's website, or the City of Springfield's website, where we will have information for you. We are entering a very new phase of coronavirus. We are getting ready to go into the fall. Combined with flu season, we understand that this is a very difficult time for our residents. You have cooperated tremendously, and I know sometimes you get tired. I think that the doctor said it well, that making all of these sacrifices in terms of not being around your families, not being able to hug your loved ones, not being able to have a newborn in your family and be able to hug that newborn, not being able to have homegoings or funerals where you can have the whole family there. Recently, one of my cousins died, and it's 12 people on one side of the family and 12 people on the other. They could not go over that 25 internally for the funeral. That's very, very difficult. Families who are hospitalized cannot be with their loved ones at very critical times. We know the sacrifices you all have made, and we are appreciative of it. But please, we ask you to continue to stay vigilant. Do your best to put on your face coverings. Use the hand hygiene, social distancing. If you have COVID, stay isolated. If you are told that a loved one has COVID or someone in your sphere, please stay quarantined. And if you travel any place that is a high incident area other than those New England areas stated, please get a COVID test. We are on the edge of making tremendous stride, continuing, and I appreciate, as I know the mayor always says, we appreciate the resiliency of the city of Springfield. We're in this together, and we're going to get through this together. Thank you. Oh, your map. That's your map.
Thank you very much, Commissioner Helen Carlton Harris. We'll now go to another important topic with family and parents and students. Superintendent Dan Warwick is here. The team's been working around the clock as we gear to reopen, first remotely, but Dan will give you some more of the ins and outs pertaining to our Springfield Public School System. Superintendent of Springfield Schools, Dan Warwick.
Thank you, Mayor. Morning, everyone. As the Mayor said earlier, we're really making great progress in our meal distribution process. That's been going great since we closed back on March 12th, and we're up to 2,275,398 meals distributed, again from 17 sites. This weekend alone, we had 84,066 meals distributed. We've added evening service, and again, we have 17 sites. We are going to, school committee took a vote last week. We're going to open remotely in Springfield. As our health commissioner said, Springfield's at that moderate level. So, it was a decision between hybrid and remote. The school committee took a look at that, took a look at some of the factors in our building, the age of our buildings, the numbers of students assigned to each building, and made a decision that for the first quarter, we're going to open remotely and then reevaluate, see where we're at, see where the infection rates are at, and then move forward. We really appreciate the support of Commissioner Helen Carlton Harris and the Health Department advising us through this process, and Patrick Sullivan and his great work in the Facilities Department. We hired a specialist. Patrick went out and hired a specialist, an industrial hygienist. Not every school system did that, but we have a lot of older buildings, so we wanted to take a look at the air exchange in the buildings. We do not have an air quality issue. We've tested the air quality in all of our buildings. The air quality is fine, but given the effects of the coronavirus, we wanted to make sure we had a proper air exchange to make it safe to bring kids back into school. So out of an abundance of caution, again, we're opening remotely. We're in very good shape to open remotely. We've had tremendous support. The mayor's team has been behind us 100%. And 5 years ago, the school committee went with a one-to-one laptop plan, and we invested millions in that plan and have laptops available for all of our students and the infrastructure in all of our schools to do that work. And for the last 5 years, we've been doing a tremendous amount of professional development with our staff relative to the use of that technology. So we're well prepared to move forward with a remote plan. This summer, because K-2 students, we had one for every 2 students, the mayor stepped forward out of some emergency grant money and gave us $2 million so that we would have one-to-one at the K-2 level also. So we're very, very grateful for the mayor's support with that. If that had to come out of our budget, then we would have had some staffing issues as we open up. So very, very grateful for that. Mayor also stepped up with the increased costs of PPE, so that we didn't have to take it again out of school funding, and has provided $3 million worth of PPE, so we will be ready when we open. And I'm very, very grateful to the mayor for his constant support. This week, we're going to have our summer school graduation. We finished summer school over a week ago, and we have a summer school graduating class every year where a lot of our students had an opportunity to make things up. We did that remotely. That went very well, and again, we'll be having that graduation on Focus Springfield Wednesday evening. So things are going good. We again, are very, very grateful to the city departments that have supported us through this process. We're going to be in the process of providing 15 days of professional development when our staff returns. And the staff, actually our counselors and ETLs and ILSs came back today. And next week, a lot of our teachers, we have a whole week of professional development before school opens, unlike most school systems that don't have that kind of time. But in addition to that, the school committee voted to add the 10 days extra the state provided for extra planning, professional collaboration, so that we can execute our remote plan efficiently. So we're excited about that. During that time, the staff is going to reach out to our families and reconnect after the summer. So for our families, they can expect to get calls from the school as they did last spring. We're also going to be making laptops available to any student or family that hasn't taken advantage of that yet. And again, looking at that distribution process and then that reconnection with our teachers. So that's all I have for this morning. Thank you, Mayor.
Thank you, Superintendent Warwick. We'll now go to the public safety update, and we'll start first with the Springfield Fire Commissioner Bernard B.J. Calvi. Commissioner Calvi.
Good morning, everybody. Thank you, Mayor. At the fire department this week, we have one person out. They are not sick. They came back from a military deployment in Virginia, and they're just out waiting COVID testing as coming back to the state for quarantine purposes. We had a small fire over the weekend, nothing too serious. The fire department's in good shape. We received a grant from FEMA, which was an add-on grant under the Firefighters Assistance Program to help pay for the outlay of protective equipment that we purchased as the pandemic was starting, and then enabling us to purchase additional protective equipment to prepare for a second surge if one was to come. That grant is just shy of $250,000, and we've been in contact with the CFO of the city, and we're getting that all planned out as to pay the bills that we had come in under deficit spending and get ready for the future. Other than that, I don't have any additional updates for this week. Thank you.
Thanks, BJ. Thank you, Commissioner Calvi, very much. Now the update for the Springfield Police Department, and that will be done by Deputy Chief Stephen Kent.
Thank you, Mayor. Good morning. We have 0 out with COVID, which is quite remarkable when you think about it, for the number of citizen contacts that we have every day. These police officers can't opt out when they get a call to a location where there is COVID or to deal with a person that has COVID. They have to go, and with almost 500 police officers, the fact that nobody has COVID is remarkable, and we're thankful for that. Getting to it, a little bit of what the mayor talked about, Friday night at about 8:45 p.m., we were alerted by the city ShotSpotter system and 911 calls of shooting taking place at the One Stop Plaza on Central Street. Officers arrived to find 2 gunshot victims. Both were transported to the Bay State. One 19-year-old male succumbed to his injuries. 27-year-old male was struck multiple times. He's expected to survive. However, he is under arrest for his participation in that event. Friday morning, the Springfield Police Department Narcotics Unit served simultaneous search warrants on Nursery Street and Edmund Wynn Circle. They made 2 arrests as a result of these search warrants. Seized was 153 grams of cocaine, 32 grams of crack cocaine, 421 grams of heroin, and more than $32,000 in cash. That investigation continues. Narcotics detectives are in the process of serving a search warrant on a safety deposit box at one of the local banks. We're anticipating more cash there. Also seized in this, as a result of this investigation, was a loaded firearm, magazines and ammunition. That was the 9th firearm seized by the narcotics unit, solely by the narcotics unit, in 7 days. When we talk about that, and we look across the country and we see the level of violence that has spiked over the past few months, we are at the exact same number of murders, 12. Not that that's a good number, and that's not that we wouldn't like to see that number to 0, but we are at the exact same number of murders at this time this year that we were at this time last year. And I think a big reason for that is the fact that not just the Narcotics Bureau, but other units are actively seeking out armed persons, and they're seizing guns almost daily. off our streets. And I directly attribute not having a spike in our murders to those seizures. Regarding the drag racers, we had 2 anti-drag racing details going after midnight on Friday night and Saturday night. Again, we had 8 arrests downtown, North End, and the South End, which has seen a recent spike in activities at the Antonios and the Sunoco. 1 officer was struck by a drunk driver, received head injuries, was treated and released, and is recovering at home. Another officer and discharged his weapon after an individual in a motor vehicle drove directly at him. We have that incident on body cameras. I reviewed it myself yesterday. It appears at this time that the officer's actions were justified. He had nowhere to go, quite frankly. So the vehicle was struck once, it continued to drive, and we are still attempting to locate it. It doesn't appear that there were any injuries. And in closing, I would like to say that the Commissioner and I are looking forward to working with Justice Ireland. I'm looking forward to meeting him, man. He's quite a guy. So we're looking forward to being able to work with him on some of the issues that have come up lately. Thank you.
Don't forget your mask, Deputy.
Oh, yep, we won't forget that.
Thank you, Deputy Ken, appreciate that. We'll now move to Facilities Management and Parks, and that is Director Patrick Sullivan.
Thank you, Mayor. The department continues storm cleanup across the city. We are completing streets today. Over the next 2 weeks, we will be completing school grounds and park grounds and safety pruning on our city streets. The splash pads continue to go well, and I just again want to thank our residents for their continued compliance with the COVID regulations. In the middle of last week, the governor released guidance that hockey rinks may open for practices only. So the mayor has instructed us to work with the Commissioner of Health and Human Services on the protocols and opening that facility for practices only. We probably will not be able to do public skating or any games at this time, but thank you, Mayor, for your support, and we will get that information probably by next week out. As our Commissioner of Health has stated, outdoor events have been reduced to 50. The governor has also issued additional guidance today on outdoor events, so Helen and I will be reviewing that. And if need be, we will be reaching out to anyone that has requested a permit if there needs to be any changes to that permit. As the mayor has indicated, we have begun our review of school buildings. We anticipate that being completed over the next 4 to 6 weeks, and that will determine how each of those buildings meet the ASHRAE standards. And in closing, it's good news when we hear from our police and fire that they do not have any COVID at this time. Helen and I have worked very closely with each of the commissioners as well as the mayor in putting protocols in place. And when you see what's happening across the country, I think it's those protocols that might be helping keeping everybody safe. So we, again, just want everyone's continued cooperation as we navigate through this. Thank you.
Thanks, Pat. Thank you, Director Sullivan. Yeah, we've been very conscientious on our cleaning, and that goes with the vehicles. Also making sure that our police and fire and other aspects of inspectors and DPW have the proper PPEs, but I don't know, Pat, you call them those guns, right? The electrostat guns that I know when they come in the office there too. So that's a testament again, cabinet heads down to rank and file. And speaking of people that are on the street day in and day out, I mean, throughout this 6 months, your trash has been picked up, your yard waste has been picked up, your bulk has been picked up, street, sidewalk work has continued to be done, and sometimes we take that for granted, but representing the Department of Public Works is Deputy Director Vinny DeSantis. Vinny D.
As the Mayor said, our daily operations, they continue to go along with no snags. I do have one individual out with the virus. It's starting his second week of quarantine now. Yard waste, we've gone full week after the storm, and we're all caught up, so now we begin our second week of the yard waste pickup. And that's about it, Mayor. Thank you.
Thanks, Vinnie. Thank you, Deputy Director Santis. We'll now, again, Springfield's in the business of doing business, and Chief Development Officer Tim Sheen and his team, they've done a tremendous job priming a pump, pumping money out on the street to keep our businesses surviving and hopefully stabilizing. So without further ado, the Chief Development Officer for the City of Springfield, Tim Sheen.
Thank you, Mayor. As the Mayor indicated, we submitted, or we are submitting this week to HUD a request for an amendment so that we can use both the CARES Act funding and additional funding within our normal CDBG round to assist the massive need that it still exists with regards to small businesses in Springfield. I also wanted to indicate that in this round of assistance, we're looking to leverage our resources using other third parties. As the Mayor indicated earlier, we are in discussions with Wayfinders, and we're Wayfinders through Common Capital that we'll be able to have an announcement with Common Capital as to how that program will be working. Finally, I wanted to say every week we get up here and we talk about all of the focus that rightfully is on the virus, but that's not to negate the fact that there's significant planning work that's going on and continues through the fall. Two significant master development plans will be unveiled in the weeks ahead, dealing with the Chestnut Street corridor and the Casino Impact District. So those will be coming forward into the public conversation. Thank you, Mayor.
Thanks, Tim. Thank you, Director Sheehan, and again for your efforts. Again, 31 Elm and Court Square continues to move forward, and we continue to move forward on the new Civic Center garage. We're hopeful for an announcement very shortly on that, and the continued neighborhood improvements that we're doing. With that, legal, as I mentioned, with Solicitor Pakula and HR Labor Director Bill Mahoney was pretty much status quo, and our financial update was given to me early this morning by Chief Administrative and Financial Officer TJ Plant, which I issued to you. So I think I've hit all my cabinet heads at this point in time. I will open it up to the media for any questions or comments to my cabinet heads or myself. And again, I deeply appreciate you all being here to get this information out. So if there's any questions or comments, Paul?
Mayor, I want to figure the name of it. What help is Springfield getting from the cross-agency COVID enforcement and intervention team that the governor announced last week? I know he spoke to you with it personally.
Yeah. Here's the thing, and again, Helen can be more specific, or Eddie Pakula on licensing or police. If we handle it first and foremost on our own, and with Helen being the point person. We've done it pretty successfully on reaching out. Helen constantly visits businesses or situations and reaching out and educating and speaking to them, working together. Subsequently, if an establishment or a situation is not resolved, then we come in with our troops if need be. Now, the governor and Lieutenant Governor Polito have indicated to me they have this like an ombudsman type activity. So if we would need any help, or if, let's say there were state type issues, licensing, state permits, other things, we'd have them swoop in. So far, it's been good, and I really want to commend Helen and I want to commend police and fire and other departments that have reached when situation has arisen. we've been proactively gone out there to visit it. And again, Helen's done visits constantly, unannounced visits. So if what Governor Baker has indicated to me, Mayor Tom, if you need more backup and enforcement, especially pertains to a state-type issue or edict, they'll get the proper units with the departments that they have with the state on it. We have a great working relationship. Deputy Kent will tell you with our state police and everything. But so far, we've been able to handle it in-house. Any other questions or comments? Taylor?
In regards to the basketball and trying to going to Connecticut, was the city consulted on either planning or public health standpoint in this?
The reach out occurred a while ago because of the edict that was listed on COVID-19 and what Governor Baker had put across it. It'd be very difficult to pull off this event. When the Hall of Fame officials spoke to me months ago, we had done that double check as we've had with other events. I had indicated that obviously I wasn't happy and disappointed. John DeLeva has given his word. This is one and done. Now, in sports lingo, our analogy, when you say one and done, that's not good. In this case, it's good, one and done. But there, John put forth that they seem to be able to get that bubble atmosphere down at Mohegan Sun. Basketball Hall of Fame, the James Naismith Memorial Basketball Hall of Fame, the invention of basketball is right here in the city of Springfield. And I expect the next ceremony to be, and continued ceremonies to be right here in the city of Springfield, where it rightfully belongs. This is an economic development hit to my businesses and to the residents of the area and tourism on it. And again, the Hall of Fame does have to get behinds in those seats so they feel that they can do it. It would have been waiting till the spring. I still would have liked to have had it here, possibly, but been really, really scaled down. So again, the president and CEO of the Basketball Hall of Fame, John DeLeva, indicates it's one and done, and that's what I expect, and that's what I demand on it. And we'll continue our working relationship with the Basketball Hall of Fame. Any other questions or comments? Okay, thank you very much for getting all this information out. I want to say a big thank you again to the residents and the business community in the city of Springfield. You've been fantastic. Your resiliency has been tremendous. Please continue to wear those masks. Helen talked about when you're walking around. I know when I take a neighborhood walk, you might be by yourself, but make sure you have a mask on you, because if you're crossing paths, put that mask on. Wash your hands. If you don't feel good, stay home. It is working right now. Again, we're about 1/4 of a point, 0.25% away for an urban center, away from being a green zone. And we want to keep moving in that direction. But you've all been great, and I know it's been very cumbersome, and I know it's been very trying and stressful for each and every one of us, but 6 months now. And think of where we were and where we come and where we're going. So just please hang in there, and I appreciate the patience that you've shown when it comes to city operations that continue to move forward. Please fill out your census. Please, please, please. If you don't count, and you won't count. And please, again, we're all set to go on voting if you want to vote in person, which I will do, but the mail-in voting they're going out every night. We have a drop box, locked drop box. So please, no matter which way you're going to vote or what issue you're going to vote on, get out there and vote, and we'll go from there. Good health, and God bless. Thank you.